Hi, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss the challenges and barriers to chronic pain. The topic of chronic pain and psychological comorbidity is one of growing concern in the medical field. There seems to have been a paradigm shift from physicians blaming chronic pain on trauma or injury or depression to actually recognizing chronic pain as its own disease, capable of being comorbid with numerous other conditions and syndromes, both physical and psychological. Medicine has moved from a pharmacologically based treatment approach for chronic pain to a multidisciplinary complementary approach, often involving very little if any pharmaceuticals. Many physicians also share the belief that managing chronic illness and its comorbidity is often more appropriate and reasonable than curing the illness. Much of the management of chronic condition is left to the patient, since the clinician can only do so much for the patient, and medicine will only go so far. Creating a true partnership between the patient and all clinicians will prove most beneficial in the long run. There are some additional barriers that present challenges for physicians treating chronic illness. There is sometimes a lack of understanding opioids and their efficacy or their spectrum. There also seems to be a negative stigma about prescribing opioids in general for pain, as physicians fear creating addicted patients. The ability of many physicians to accurately assess the patient's pain can create barriers to effective and timely treatment. There also exist barriers that are brought on by the patient, and with fibro this becomes critical. Poor communication can be a critical miss in the doctor's office. A patient needs to be able to effectively explain their condition to the physician. The physician may not properly participate in the treatment for the fear of side effects or addiction to medications, or just out of being too symptomatic or sometimes too lazy. The fear of pain itself possesses a strong barrier that exacerbates pain. Beyond the physician and patient, the healthcare system in general can be a major constraint to treatment. Thanks for listening.